hopeful news coming out of the state capitol today. Oklahoma Speaker of the House said a stash of funds could delay cuts to some health care programs. That includes jail alternatives for inmates with mental health issues. Lawmakers would still have to find a budget solution by 2018 to avoid the cuts altogether. 2 Works For You reporter Micah Hatfield explains the impact it could have.
Brian, right now there are about 420 people in drug, alcohol, and mental health court in Tulsa County, the largest program in the state. All of those people will be stopped in the middle of their rehabilitation if the state chooses to cut funding to those programs. All of those people deprived of the opportunity that Crystal Hunter got to turn her life around.
I was lost. I was lost with my kids. I didn't have the right coping skills, tools to deal with everything I was going through.
Crystal Hunter was given a choice by the court system after an arrest: 5 years in jail or going through drug court. She chose drug court and was put through an 18-month program.
And nothing was going to change. If I went to prison, it's a vicious cycle. I'd get out and right back to the same thing I was doing.
She says it taught her how to live a normal, productive life. Her life and her kids' lives were transformed. But if funding is pulled, not everyone will have that same opportunity.
More than likely, if they are put in incarceration, their children are more likely to end up in the criminal justice system. So we're creating generational impact as well.
The likelihood of someone who goes through drug, alcohol, or mental health court becoming a repeat offender is between 8 and 10%. People who are incarcerated have a 55% chance of reoffending in the first 2 years after their release. What seems like a solution to a budget crisis may just make things worse.
In Tulsa County alone, it would have a negative impact of approximately $10 million per year to taxpayers, to the costs of our state, to incarcerate them rather than sending them to treatment.
The estimated cost statewide to incarcerate the people who would usually go through treatment programs is $122 million. In downtown, Micah Hatfield, 2 Works For You.
Right now, as the